I'm Lee Doherty Biddison.
And I'm Carolyn Kamsty Fowler, and we're your co-hosts for the Johns Hopkins Office of Wellbeing's podcast, Vital Conversations, Influencing Workplace Wellbeing in Healthcare.
We spend a lot of time thinking about how to influence workplace well-being in healthcare, and we're excited to share what we're learning.
Thank you for joining us.
Hello and welcome to the Vital Conversations podcast. I'm your host for this episode. My name is Lee Doherty Biddison, and I serve as Chief Wellness Officer for Johns Hopkins Medicine. I'm thrilled to welcome my friend and guest, Dr. John Ripp. John is joining us from the Icahn School of Medicine at Mount Sinai in New York, where he is a professor of medicine and senior associate dean for wellbeing and resilience. He also serves as one of the first chief wellness officers in the country. And it's just a pleasure to have John. Also want to mention John is the co-founder and co-director of the Collaborative for Healing and Renewal in Medicine, or CHARM, which is a wonderful organization that I hopefully we'll hear a little bit more about later on. So John, welcome.
Thanks so much. It's great to be here.
Well, I am thrilled for this conversation. One of the things I love about doing this podcast is getting to talk to my friends who are doing great work in this area. And John, as I was preparing for this podcast, one of the things I reflected on is very early in my role as Chief Wellness Officer, we lost a faculty member to suicide, and it was devastating, obviously for that person's family, but also for the teams. And I remember one of the very first people I called actually was you. It said, John, tell me what you know. How do we handle this? How do we respond? How do we support our people in this really difficult situation? And you were so gracious in both in supporting how I was feeling in the moment, but also in helping us think about how we can respond to this as a system. So maybe if you could just comment a little bit on why it's important for us to be thinking in advance of an event where we might unexpectedly lose a colleague, why it's important for us to be thinking about how we'll handle that, and what's the role of the well-being office in really trying to tackle that.
Yeah. Well, thanks, Lee, for opening a discussion on such an important issue. One that I think all of us in well-being leadership roles either have experienced, unfortunately, or really we're sometimes feel like we're kept up at night thinking about this kind of event. And when it does happen, it really does command everyone's attention, appropriately so, and in a way that that really requires a response, and requires a response in a time where things feel really emotional and chaotic. So, I'm reflecting on back all those years when we spoke about this, and thinking about my own experiences, because we've had a few, and it's still very fresh. It feels very fresh, and it's the kind of thing that sticks with you. It's important to have. It's important to have an organized response. And, I'm not like an emergency management person by background. But when dealing with an event like this, you realize that it's really critical to have like a protocol, to have a guidebook, a step-by-step guide to follow, because, inevitably there's going to be a lot of voices that are making suggestions or that you need to work with, and there's going to be appropriately a lot of emotion that often makes it hard to do the work. So I completely sort of sympathize with you. I'm feeling it now,
Right.
Back to those moments and reminded of my own. So yeah, again, thanks for bringing up this important conversation.
Well, I love what you're saying about the protocol, because I think, in particular, like as we were, trying to move through that situation and provide support and help guide, how do people who are reaching out to us for help, how do they respond? How should we encourage or support or guide? our institution respond, is that we've got to manage our own emotions. And one of the things that, you know, I recognized in that situation I mentioned to you and has come up again since is that our own sense of responsibility. I'm the chief wellness officer. I'm supposed to be sure that everybody's okay. And somebody was clearly very not okay. And how do you, you know, manage that experience? Of course, it isn't all, but it's absolutely not all about us. But you have that own experience, and you need to be able to. Also, protocol I think is helpful to help us set aside those pieces and say, okay, now here's what we've got to do. Thought about this, and here's what we're going to walk through. Here are the pieces that need to be brought together to provide that support in real time. And sort of put ourselves aside in that space. But it's intense for everybody's involved. Maybe could you talk a little bit about sort of as we think about we just have mentioned a protocol a couple of times. What are the things that should be in that? Like if somebody's listening to this and says, "Oh my gosh, we need to do that," like what would you say has to be there?
Yeah, yeah. Let me answer that, but I can't help but reflect on some of your comments that
Sure,
immediately
yeah.
did that because you know, I often say that when you're in well-being work, if you're a chief wellness officer or healthcare well-being leader, you know, you're often involved in the opposite. You're involved in
Absolutely.
dealing with sort of distress or things that are getting in the way of well-being that are inhibiting fulfillment in the workspace. And so, you know, that and I think you know you spoke of charm and this community of well-being leaders that we have. You know, it's critical to be able to lean on others and you know who are doing similar work and kind of you know particularly in those times where you know I would say on a regular basis we're dealing with distress in various amongst various segments of the workforce. But when it's a sudden tragic death, when it's a suicide, it is going to take a toll on you as an individual. And so the protocol allows you to lean on that when you know your head is abuzz with all the many things, the sense of responsibility. You know, you alluded to it, the sense of guilt. You know, is there something I could have done that would have prevented this? You know, so it's really important to you know, and again, I've learned so much from emergency management people. You know, I've learned a lot from our experience in COVID. That you know, there are times where you need to just you need to just follow a step by step guide.
Yeah.
Um, and I'll just share an anecdote with you around a time when I personally, and I will answer your question, I
Of
promise.
course. No,
But
we got time.
there there was a time where I needed to step aside from the role of overseeing the well-being crisis response it was not a suicide, but it was a sudden death of a faculty member. And the story goes like this. It was a day like any other. I was in my office. I was either having meetings or, you know, getting some work done. And I got a call on my cell phone from the head of a residency training program in a department that one of the faculty members had moments ago been killed suddenly in a car accident.
Hmm.
And while he was biking and was killed suddenly. And you know, so obviously I was very shocked when I heard this. I was like, oh my, you know, oh my goodness, who was this? And the person who called me told me the person's name, and I realized it was a good friend of mine. And so yeah, I mean, this was many years ago, and you know, I've processed it, and you know, our community has rallied around the family. So but it was a double loss. It was a loss within my work community. It was a loss within, you know, my community of friends. And so I began to implement the well-being response, the protocol, because that's my job, right? And I called a meeting together of the way our protocol works, and this is to answer your question, is you know we have leads that represent all the key resource groups that need to act in the wake of this. So you know we have behavioral health and spiritual care and marketing and communications, my office, emergency management, and others. And I called the meeting together and I began to run it. And I was sharing the story. And then at a certain point, I shared that this is a friend of mine to this group. And I think it was the head of emergency management service who stopped me and said, wait a second, you really shouldn't be running this effort right now.
Yeah.
And it was like, of course I shouldn't be running this right now. How could I even be doing it? So, to your point, these are incredibly emotional. It's going to take a toll on us no matter what. And there are times where we may need to step aside. Having the protocol is really important. So what are the main elements of the protocol as we have defined them? And we've really modified some great resources. The ACGME has a response to a suicide toolkit that a lot of us are familiar with, which really, provides a step-by-step guidance. We kind of modified that a bit based on our own needs in our community, and each time an event happens, which in an institution that has 45,000 employees, unfortunately it happens, with some periodicity. You learn from each of them, and what we've learned over the years is that there's two main areas of focus. One is messaging, the other is providing support. Support in the form, quite honestly, in the immediate term, it's less so psychological support because people are not ready to sit down with a therapist within 24 hours. It very well might be spiritual care that they're often extremely helpful. It may be just someone who's skilled at managing a sort of a debrief session where we just come together and share our thoughts about the person that we've lost. So there's the support elements, and then there's the communication elements, because inevitably a message needs to be sent, and that can be very complicated depending on the circumstance. So there's always unique circumstance. Yeah. So, who do you send it to? When do you send it? What do you include? What don't you include? Who's been in touch with the family? What is the family, what are the family's wishes? But all that, I always say that is good. That's important work to do by group and not by individual, because you really need to rely on sort of the sensibilities of a lot of thoughtful people to weigh in on those. So anyway, long answer to your question, but as it relates to the protocol, I mean, it goes beyond just those two domains, but those are the two major domains in our experience.
Gosh, there's so many things I want to ask you, but I want to just pause for a minute on a piece that you shared about your friend who passed, and one of the things that we learned in our experience, taking so many lessons from you, was that unexpected deaths come in many different varieties. That I think the ones that tend to be, I don't know, most talked about perhaps are deaths by suicide. But I think it's also really important for us to remember that a sudden death of someone you spend 8 hours a day, 5 days or more a week with over months or years is going to be shocking regardless of how they died.
Right.
And disruptive, and trying to be sure that we acknowledge in appropriate ways the impact of any death and any loss like that, I think has been incredibly important. And clearly there are special considerations in the context of a death by suicide. But
Yeah.
but to your point, we have, I think our organizations are of similar size. And to your point, like statistically speaking, in a group that size, there will be members of the group who pass away for any, one of many reasons. And
Yeah.
and being prepared to support folks in that is just so important.
Yeah.
Maybe just a little bit more to go a little deeper on communications, because I think one of our early lessons as an organization was about that it is important to know what not to say as it is to know what to say. Do you want to
Yeah.
maybe comment a little bit on that?
Yeah, for sure. It's incredibly complicated. for so many reasons. Well, I would say one main reason, it's very easy to get a message wrong in
Yes.
in those circumstances. And it's, if you're not really thoughtful about what goes in it, if you just, yeah, and a lot of times there's a sense of urgency to get a message out. And it's more than a sense. I mean, there's as you mentioned, each circumstance is unique, and they happen, with such a large community, they happen. I was thinking about this the other day. 45,000 people. That's like a large town, a small city, right? Like,
Yeah, it is.
so these are life events that happen. So, um, y- you know, there's a lot of considerations. So there's not only is there a sense of urgency, but if it is, if, and we've come up with a couple of, almost like questions you ask, like, okay, was this very public knowledge or not? Right. So people will die, if it's a car crash, if it's a suicide, if it's a violent death, it might be on the news. And we've had those experiences. And when that's the case, the sense of urgency is dramatically ramped up, not because you need to notify people, which you do, but there's all this sort of human nature and psychology that begins to set in amongst the community, which is natural, and that is that if the institution is not saying something about what just happened, then they must be withholding some information,
Right.
right? That's kind of which is actually, in my experience, which is it's really never the case. There's times where um, it's the cause of death is not public, and the family is really insistent that they don't want you to release the cause of death. And unless you can think of a reason why it's important to do so, which it's hard to imagine, you might want to you not might want to you take into account and respect the wishes of the family. And so there might be, you may not be giving all the information. So aside from some circumstances like that, you're going to want to relay information, and if it's very public, it's important to just send a message quickly. It's usually a message just expressing sorrow, but it's important to do so because uh, again, well-being work, it's easy to lose trust in folks. It's very hard to regain or build it. So there's that element of it. If it is it public or not public? What are I mentioned, what are the wishes of the family? Um, when it's a suicide, there's the unique situation related to contagion. There's a known phenomena of suicide contagion where someone who is at risk for suicide who learns of another one may become at greater risk.
Right.
And so sharing that information without good reason can actually be hazardous. So that's another special circumstance where you need to very carefully think about details within the message. And then I think the last thing I would say is just determining the scope of the audience. So if there is let's say it's a student death, which is going to be very presumably a young person, whatever the circumstances, that's going to be very shocking because it unexpected and obviously quite sad. And so in those circumstances, you have to start thinking, okay, well, we are a school and we are a hospital, and is someone who works 100 miles from here in a hospital that doesn't have students going to know about this, and do they need to know about this? And so it can be a little bit macabre to kind of like talk about this stuff, but it is important. If we talk about circles of impact, what's the impact? What's the circle of individuals connected to the person who died, who's most impacted? Is there a sort of a secondary circle? And we use that to inform our thinking about the scope of the audience. we send the message to. We want to get it right. We want to make sure that people who, who might have heard, who are connected, they hear. And largely, again, it's a message of condolence, and it's a message of support and comfort, and one that has the level of detail that you're comfortable sharing.
It's Just a couple of things come to mind if we could dive a little deeper. One of them is this question about in the event of a suicide, balancing the wishes of the family, which are incredibly important to honor, but also the experience of that individual's work family, as it were.
Yeah.
And there can be situations in which a family says, I don't want anything said, which can leave a real gap
Yeah.
for folks in the workspace. And so that's another one of those situations that I think it's really important. I think in this case, you can't possibly write out all those things in a protocol, but for the design plan you've talked about, you can at least have that group of people who can come together. These are all the folks who help, the communications people and leadership folks and emergency management and mental health support, coming together to say, okay, how can we navigate this in a way
Yeah.
that honors the wishes of a family member, but also respects the needs and experiences of the work group, which I think is just so important. And I completely agree with you. One of the other things that I think, to your point about the concentric circles, is, we have circles and we also have the matrix, right? So if there's a student who passes, well, we know to say something to their classmates, and if you're on a clinical rotation, then maybe to the residents who are on the same clinical rotation, but maybe we don't know whose lab they happen to be volunteering in, or which free clinic they're in. There are these layers of trying to identify networks and to create opportunities for support that can sometimes be a little challenging to tease out.
Yeah, and I would say those are steps in the protocol. So that you mentioned it. So one of the steps, which is it's a step, but it's got multiple steps within it, is communication with the family, and let's come back to that. And then the other step is like identifying the circle of impact, right? So so part of the work of the group that comes together in response is to say, okay, who is this, and in asking who is the audience to message, you got to say, okay, who is this person, and who do they interact with, and that's why, again, it's really good to have a group of people, because between multiple smart people, you'll eventually, like, all the right questions will be asked, like the ones you just asked. Okay, who do they do rotations with, and what do they do, extracurricular, and where are they doing research, and sort of, so that and then the other thing I will say is, there's a whole, like, a continuous improvement element to these these responses, because my experience is you never quite get it right. Like, there's always something you're like, oh, I can't believe we forgot that. And then hopefully you learn, and the next time, you don't do that again. Keeping in mind that every circumstance is unique. So I think that's a critical piece. And then, the bit about what do you do when the family says you may not say anything about this. And yet, there's like a group that are really in pain, like a group that works, or, in the case of students, maybe they live together and so forth. So, there's a group that's in pain that you feel a responsibility to address. The family is in pain. And, I try to, I do some palliative care. I know you're critical care medicine. So, I try to lean on some of those skills a little bit. It's kind of, I think about the example of, like, the family of a patient who's dying, who says, you cannot tell the patient that they are dying. You cannot tell the patient what their diagnosis is, and in palliative care, we try to find a middle ground, because oftentimes the patients know, they understand,
They know,
what's happening themselves, right? So, And it just creates all this tension when everyone's, dancing around the issue and not talking about it. And there's all kinds of belief systems that weigh in there. But I try to, lean on those skills and say, okay, well, this decision not to share any information about the loved one who just died, is that a hard and fast? Like, let's have a conversation about it. Let's try, to the best that we can, talk to the family and say, and then make a case for why we'd like to share something, and explain all the people that are hurting, and try to find some middle ground.
Absolutely. It's a constant negotiation,
Right.
but an important one. An important one. Um, could I'll put you on the spot and just ask you: Can you think of a thing or two, maybe just at a high level, that have ended up in your protocol or your approach that you're at the outset when you first started in this job, or would not never have guessed would have been there?
Specifically in the protocol, like in
Yeah.
the response to um, something that surprised me about being in there beforehand, like.
Didn't occur to me that we would need to say this or that we would
Got it.
spell this out.
Got it. Yeah. Yeah, I mean, the truth, I would sort of think of that question a little bit of, you know, what are the lessons that you've learned, that because, it wouldn't have been a lesson learned if I had thought about it ahead of time.
Right. Exactly.
It's so strange reflecting on these events because they happen with some frequency, but a recent one, um, was someone who, was here on a visa, a researcher on a visa, and um, I did not think about, you know, what about all of, first of all, the transfer of the remains to
Right.
the family in another country, and then the release and transfer of, personal effects. Um, I just did not think about that. I did not
Well,
think
that
about
could actually be challenging, even if it's somebody who lives 3 blocks from the hospital.
Yeah. True,
Yeah.
true. And but, uh, the lesson learned is that, you know, it's lean on your colleagues who have expertise. So, like, we have some colleagues that, their entire work has to do with visas for our foreign, folks who work and do research and learn and so forth. So that person was able to figure it all out, and I felt very grateful, to have that person as part of the team. But yeah, that was something I just didn't think about.
No. Right. There's always some nuance.
Mm.
You're absolutely right. I would just say that one of the things that struck us, and we recently did the work of creating a guideline as an institution, and as we shared that internally, it was really striking the amount of appreciation that was shared. Thank you so much. For just thinking about this, for having a plan, um, because writing it down somewhere. It's not something that can be, even bring it coming to this on a podcast. It can be a little awkward, right? Nobody wants to think about this. Nobody wants to talk about it for a good reason. These are really difficult situations. But the more we're willing to, and you have this such experience in this in palliative care, John, for sure, willing to face those hard conversations, the um, more satisfied we'll be with the outcome and how it went afterwards, as opposed to the, oh crud, what do we do now
Yeah.
conversation, which can happen if you don't plan.
Yeah, and what I will say is, providing guidance during those periods of time, and that's actually, what I didn't speak to, is in terms of the structure. I don't think I did. Is, so this response currently lives, under my office, the Office of Wellbeing and Resilience, and but there's actually, the truth is what we do is just operational oversight, and we provide guidance. Ultimately, when there's a death in our system or school, there's a need for the immediate leader to have a role. And whether it's the a dean in a school, or a department chair, or division chief, or what have you, that person as the leader of the circle that's impacted, they have to have a role. In fact, they should be the ones that are doing the communication with their own people. They should be the ones that are present during times to reflect. And so a lot of what we do is we just provide guidance. And
So important. Thank you.
yeah, I mean,
raising
we
that.
just, yeah, and it's, for me, I'm always assessing the extent to which I can step back because this person's got it. They've got it figured out, or the extent to which I need to kind of lead a little more and say, hey, you should have this, you should cancel this meeting, you should have this session, you should send out this message. So it's always kind of figuring out. But what I will say is, when and yes, it's important to send out, notify people that you have a protocol and that you're there for them should this rare event occur. When it does occur and you're there to support those leaders, there is no group that is more grateful to me in this
For sure.
institution than those who we've provided guidance and support when someone that reports to them or in their space has died suddenly. And they're just, they know they have something they need to do because they're a leader, but it's absolutely not what they've prepared for. And so for us to be able to do that, those tend to be the folks that are most grateful.
Gosh, it's such an important point, and the key role of those trusted communicators and trusted leaders, right? It wouldn't be effective if we were just to step in and sort of take over for them. So thank you so much for highlighting that. But sometimes the trusted communicators just don't have the words, and so being able to support them and then thinking through how important as well-being leaders it is to build the relationships with those local leaders in order to really further the work and effectively support their team. So important. Okay, John, I could keep going for hours, but this has been so helpful. Thank you so much for coming on the podcast and having this conversation. And I'm really hoping we can do this again sometime.
Yeah, it's been great. Thanks for, again, such an important conversation. Thanks for setting it up and inviting me to speak.
Well, my deepest heartfelt thanks. So for everyone listening, this is Lee Doherty Biddison signing off for the Vital Conversations podcast. Thank you.
So that's it for today. If you enjoyed what you heard, please share this podcast with a colleague. And as always, we welcome your feedback.
If there are any topics you'd like to hear about, please email us at owb@jhmi.edu.